Types of treatment. So the treatment that's most common for women that are diagnosed with breast cancer is surgery most times. And then the surgery can happen before chemo or after. If the chemo is before surgery, it's neoadjuvant chemotherapy, and if it's after, it's adjuvant chemotherapy, and it depends on the stage of the breast cancer. Yeah, and then the surgery can be either lumpectomy or mastectomy. Lumpectomy is when part of the breast tissue along with the cancer cells are taken out, and then the margins of what was taken out is examined to see there is no cancer left on the margins. If there is, then the surgeon would go back in and then take out some more breast tissue until the margin is entirely clear, meaning like all of the cancer cells have been taken out. And that's lumpectomy. Mastectomy is when all of the breast tissues are removed. So it can be unilateral or bilateral, meaning like just the breast that was affected is removed, or both breasts are removed. And if there is lumpectomy and radiation, which I'll talk about what that is, and then there is recurrence of breast cancer, then there's no option but to do mastectomy, which is removing all of the breast tissues afterwards. And then with these surgeries, there is reconstruction, so you can choose to have your breast shape reconstructed. And essentially that can be like different types. There can be implants or expanders put in and later replaced with your own tissues. And then the other surgery that happens is removal of some lymph nodes in the underarm area. So a sentinel node biopsy is done, and depending on the extent of lymph nodes that were infected or touched by cancer, that's removed. Now, switching over to radiation. Radiation is like strong X-rays or radiation being put into the breast, directed at the breast to shrink the size of the cancer. And there are different types of radiation. And then chemotherapy is using medication. So sometimes there's a port put on the breast, and then through which the medication is applied. And these are like strong medications and depends on the receptors and the protein, like HER2 protein and things like that the doctor will determine what's best. And then also if this is pre-menopausal or post-menopausal, I believe. But anyways, that's chemotherapy. And sometimes I think it's pills as well you take. But I've heard most times it's using a port and put in through like intravenous. And then there's hormone therapy, which comes at the end, which is 5 to 10 years. And that's medication depending on if you have ER positive breast cancer. There are drugs that help suppress that kind of cancer. And also, again, depends on the age and premenopausal or postmenopausal. So those are the various treatment options. And there's also immunotherapy and natural therapy, but don't have a whole lot of information on those to share. Didn't make sense for me, so haven't explored a whole lot.